Wasn't really pretty hard planning in a way that they would have liked, and they do when that happens. They were
so and so here. You can probably get
but they give you my status.
right. And it's still.
So they have today I started like trying to figure out transferring like how if I need it it's like
I was thinking about that. I know that.
that's what they did. The renovations. Why did you ask for a cash? But now it's bigger.
Everybody. Are you able to hear me okay? Okay, so Barbie said yes.
I got in there.
How about back there? You hear me okay?
Yep.
Cool beans, thank you. So thank you also for taking time out of your busy day today to come and spend some time with us and to give us some feedback on what we need to do. And when I say we Adamus, we the community need to do in terms of bringing new crisis services online within Montgomery County. So that's what we're going to be talking about today. In order to kind of kick off the conversation, I just want to give you a few points of information that explain what got us to this place and why this conversation today is so important to us. We did a session last night. We have this one occurring right now. We're going to do one more on Thursday. We're doing it at different times, different places, because we really do want to be inclusive of as many community members and stakeholders as possible. So we, Adamus, are in listening mode today. We want to hear from you. You've heard a lot from us. If there are critical questions that come up, we're going to be collecting those and we'll be able to get answers out to you. But we don't want to spend the time rehashing a lot of the conversations we've had about this already, just within Adamus meetings. This is a community meeting, and we really want to be able to hear your feedback based upon your experiences from wherever you are situated within our community. So just to give you a few points of the why, the where we've come from with all of this, I'll speak to those and then I'll have our facilitator take over from there. So Adamus is not fulfilling this meeting. This is one that we're having facilitated by someone who is not part of our system of care, so that we hope it will make you feel even more comfortable in providing feedback for all of us. So the conversation for today is about crisis services within the Montgomery County region, particularly as we look at call center work, mobile crisis work, and crisis stabilization unit, or the center. The work began in our community with RI International. They were the provider of this work, and we have been working with them for about 5 years. They have been providing the services after ramping up for about 3 years. While they were doing this work within our community, they were able to touch over 38,000 lives. within the community. So it's important to know, just kind of as a base, what we have as volume in terms of service needs. And that's what we know right now. We know that needs continue to increase, at least on a daily basis, within our broader community. So that's an important element of the thinking around this. Another aspect of this is the sheer number of calls that were being answered within the call center. We do have a 988 assigned call line. Our call line in the past year handled about 40 calls on a monthly basis. The bulk of our calls were handled, again, by that same provider, RI International, to the tune of about an average of 1,200, excuse me, on a monthly basis. There was a month when there were 1,800 calls being answered. That too speaks to volume in our community. And I'm saying that specifically for those of you who may be providers who have an interest in the provision of these services when we move forward to the next stage of the conversations around the service continuation within our community. Currently, the only service we have is the call center. It's being offered by 988. And we do not have a formalized crisis response unit, nor do we have a crisis center at this time as part of our continuum of care. So it's important to know those aspects as well. We are going to be, after the third meeting, inviting a group of stakeholders to the table to talk about the creation of an RFP. That RFP will be issued, we hope, in August. That's the plan anyway. I need to watch what I'm doing here, make sure I'm not touching anything. And then we would have that group help us develop the RFP and be able to kind of bless that. And then we will put that into the community for response, with hope of having a service provider identified and ready to roll no later than January 1. So right now we're looking at the 6-month period and getting through this part of the process and getting to January 2025 at the very, very latest. With all of that said, our interest is in local providers. If you've heard and read any of the many segments that have been throughout social media and the news, we're looking primarily for local provision of services, and we're certainly looking for that service provider that is certified and fully understands the needs of those people who are considered our end users. Because we heard a little bit last night about this, and I suspect we'll hear today from some of the people who are struggling to find replacement services, since we no longer have those in the community. So we really want to be sensitive to the needs of the community in this process. With that said, we have engaged Scott McGowan. Many of you know Scott. He's certainly very involved in the community. And we've engaged Scott. And when I say engaged, I don't mean that in terms of dollars. I mean in terms of the kindness of his heart and his certain understanding for the system of care and the needs of our community, to facilitate these sessions and to be able to bring forward from you your information. As I started out mentioning, as I began, if there are critical questions, we'll capture those and we'll be responsive back to all of you. You've all signed in. We have a means of being responsive back to you. But right now, what we want to do is hear from you all. So with that said, Scott. Thank you.
Absolutely, thank you. My name is Scott McGowan. Thanks for being here. We know this is an important topic. I spent 59 years in this community. So I'm born and raised in Dayton, kindergarten in Myers-Brigg, went to middle school in West Carrollton, and high school in Centerville. Married my best friend for 37 years. Her name's Lori. I've got 2 children.
USB port. Somebody in charge of IT is not going to be happy with me. Okay, I think I put it back. There we go. I've had two grandchildren. Those of us that have grandchildren, we should have had them first on this planet. And then I've got another son, his name's Taylor, and married to a beautiful girl named Megan, and they're expecting their first child. This community has given me, it's given our company, Montgomery County, a lot, and I believe in my last third of my life here in this region that I owed more. And that's why I care about this so much. I care about this topic deeply because about 16 years ago, I built my whole life from the outside in. And I thought that your opinion of me for most of my life was more important than my own opinion of myself. It brought me to a point 16 years ago where I didn't want to live. And quite frankly, I just wanted to die. By the grace of God, I found the recovery rooms inside of Dayton, Ohio, and had the courage to walk in and say, my name's Scott and my soul is cooked. And I've seen redemption and restoration come alive inside of recovery. My only quest here today, I don't have a horse in the race. The only people that I serve, and I feel like I'm living on purpose, is when I'm on a quest to serve the lonely, tired, broken, and afraid, because there's many in this community. And so bringing alive this topic, it's a big subject. As you know, it's complicated. And so what I want to try to do is facilitate a conversation that hopefully allows us to be able to put some strategies together as Animus begins to put together this RFP. What are some things that are really, really important? At Montgomery County, when we held meetings and it was larger than that, we always used this acronym called WAIT, and it stood for Why Am I Talking? And it just helped us maybe kind of think about before I'm about to speak, some things that we ask each other to consider. Number one is, I'm about to say, is it useful? So as Helen had said, what we're here to talk about is, obviously we lost a crisis center, we lost crisis call, and we also lost the mobile crisis unit. So what we're here to talk about, if we were going to bring that to life in a different, what would that look like? What I'm most interested in is what would be new, better, or different than the program that we had before. I also am interested in a solution that talks specifically about what that might look like and how that might operate. Me personally, I'm not that interested in what happened or why it happened or who. It's important, but I think as we think about what's most important is to think about the future. When Tina had called me and asked me to do this, I said I would do it under one condition. And that condition would be, I don't want any reference point in regards to what happened, who was involved, what happened, like any of those details. And so I stand here with a passion for mental health and for substance abuse, and what's a better solution here. So if you're talking today and maybe you're talking about who or why, what I would ask you, I might divert you into focusing on maybe what and how. Fair? Secondly, if maybe some of us have something we really care about, you might be maybe repeating what somebody already said. So what I might do is maybe just, we'll write that on the board and divert you to another topic. And then lastly, we have a large room here. We want to make sure that everyone gets an opportunity to speak. And sometimes maybe if we're speaking too long, what I might do is just tap my wrist. That doesn't mean stop talking. What that means is maybe just finish your thought. Does that make sense? Is that fair? Now I say those three things, and trust me, I didn't do it last night because that's not easy to do, right? We have a lot of people in this room that deeply care about this subject, and I care about this subject. But I think the one thing I can promise you today is that what is important to me is that we all treat each other with dignity and respect, and our character shines in this topic. Make sense? Fair. So I'll start off with, we pass out the cards in the back, and then I'm gonna hand you the mic. What I'd like you to do, because we have some folks on Zoom, and they might be adding some chats, and I'll be looking at that as well. So if you would, maybe state your name. If you could help us maybe identify, we have providers, social support, law enforcement, justice system, hospital system, lived experience, families and friends. Does that make sense? If you could just call that out. So where is number one? I'm going to hand you the microphone. Fair? I'm going to get my steps in today.
Your expectation?
Yes.
Georgianne Godsey, I'm a trustee in Harrison Township. I've lived in Denver over 50 years, and this subject definitely touches me personally. Yes, I'll wait until later.
2.
My name is Doug Mowry with County Behavioral Medicine Center, and this is my first opportunity to get to one of these meetings. So once again, I'm just interested in kind of hearing where we're going.
3.
Hi, I'm Dylan Benjamin. I am the behavioral health manager for 5 Rivers Health Centers. Prior to coming back to Dayton to work for the previous 5 years, I helped manage the mobile crisis teams for Butler, Warren, and Clinton County. So very invested and interested in the future of this community as well.
Can I ask you a question?
Sure.
What worked really well with the mobile crisis community?
So 5 years in to when, for the 5 years that I was there, the individuals who were previously there had taken over the forensic system in Butler County 10 years prior. So longevity is one, right? Community connection and access. However, the one thing that really helped was everything being housed under one provider. And so for what we found, again, over the time that I was there, having not only community mobile response, having MRSS, which I think would possibly be unique to Montgomery County, a connection with the hospital system in Butler County, who was managing the mobile crisis line, as well as, well, they did not in Butler County yet have a crisis receiving center. So not only the longevity of the system, the community connections, the constant access in not only daytime staff, but after hour staff as well. So there's always individuals readily available. The one thing in addition that worked really, really well was we had a Butler County Sheriff's Deputy on staff, and that was wonderful. There is some contention within lots of different systems of care around the community, around the country, related to, do you bring law enforcement on calls? Do you bring EMS personnel? Do you just have social services providers? We always found that having an officer, a highly trained CIT trained officer who was not in traditional police gear, but in kind of a less, acute garb was very helpful to the entire system.
Thank you. Sure. It's kind of the same thing we had heard last night as well. You were 3? Okay, I knew I'd lose track. 4.
So I want to make sure, my name is Tara Campbell. I am the executive president for Dayton United for Human Rights. And I want to make sure that I stay in line with what you're talking about, but I do want to have some questions put up and understand how the questions will get back. So when I signed in, there was not an email asked. So I'm really confused of how you're going to communicate back to us in regards to the questions we had, because you didn't ask us for any way to communicate back with us when I signed in. That's the first question I have. The second question is, I'm coming out representing the large amount of people that do not understand what happened. And so I'm thinking I'm coming here today to understand that process so I can report back to community as to where we are and what we're looking for, where we're going. And so I understand that this is not the space or the setting for that. So how do we figure out that and understand that going forward as to what actually happened for the community? My next question would be, we're looking to January 1st of 2025 to have more services after doing an RFP. Why can't we go back and use crisis care to be able to provide the services that's needed now for our community instead of keeping us wide open? And so those are things that I'm looking to, I thought that I would have an answer to today to be able to go back and talk to community about, but those are really important questions that community is looking for to understand that 26 years of crisis care and where are we now to not having services to January 1.
You see, perfect. There's an email for you. So I think, and the other thing too, also, Tina, there was a fact sheet, I believe, right, that was available that would kind of walk through and unpack specifically maybe some of the details in regards to what happened. And I'm sure we can get you one of those as well. 5. Oh,
I am a citizen of Montgomery County. I have a grandson who has some severe problems. Currently, he is hospitalized in Cincinnati at the hospital there. And my daughter, she's been affiliated with the different programs, but I'm not. And we need help. So I'm here to learn anything that I can about this.
6.
I'm 6. Yeah, I'm Janice. I'm also a citizen, and I have been friends since childhood. Um, I have a 54-year-old mentally ill son that was diagnosed in the military, a 47-year-old daughter that's in denial, so she lives in and out of shelters. I have been able to help other families to deal with their mentally ill loved ones, but my problem is a lot of times they don't have insurance, and I'm here to find out what is a better, quicker way to help these families. So I'm an advocate.
Well, last night we talked about, there was certainly a lot of conversation about that. And I think most of us in this room have probably already heard, I believe there was a mental health hospital that was discussed. I think 200 beds. I don't know, that's probably, we're talking years out, right? I mean, that doesn't happen overnight. So, obviously the impact of mental health, and especially in family members, is dramatic and it's difficult. We also talked a little bit last night around the elements of insurance, whether you have it or not, whether it be Medicare, Medicaid, or also commercial insurance, and what's the impact on that as well. 7.
I'm Nicole. I'm a crisis social worker in the Dayton community. I've only been here about 5 years, but worked in a couple of different crisis roles. I've done co-response with police. Right now I work for the city doing alternative response to police. And so I'm just here to learn a little bit, talk a little bit, and maybe offer crisis provider insight.
I'd ask you, so if you think of the crisis care to mobile unit, right? So that's important, and then that's what you were involved with. You had crisis center, so intake. Are you familiar with that?
Yes, so I did not work for the crisis mobile team. I worked for the mediation response unit, which we utilized the crisis receiving center often, and we worked alongside the mobile crisis folks. And then in my previous role, I worked with crisis care alongside them as well.
Just ask a question. I don't know the answer.
Okay, I may not either.
But would you say that a receiving center is important?
It is important, and I think our dream, when we were taking folks there, is that they would have longer than 23 hours to be there. It didn't feel like enough time, like somewhere that folks could go for a little bit more time, or maybe be pink slip there. That would be so having more time for stabilization, I think, was our dream. But it was really helpful that they would receive folks no matter what.
The other alternative is
The hospital or jail.
thank you. 8.
Hello, my name is Carlos Walker. I'm the director of Montgomery County Health Probation. Just here trying to gain more information. Like you said, I think we need more longer terms as far as besides 23 hours. I know as far as support and probation, we deal with a lot of individuals just keep going in and out of the jail. Some type of stabilization to help these individuals because we deal with them all the time. Personally, a lot of my staff's not even equipped to deal with certain.
So how would we make, one of the things that we talk about is how do we make this new, better, different? So how do we make that new, better, different?
I think basically to the communication with somebody such as law enforcement and also just trying to divert some of the individuals instead of taking them to jail. I think keeping them out of jail and helping those individuals before they even come to jail and deal with the court as well.
Gotcha. We were talking about that a little last, somebody brought up just the importance of prevention in that area.
Correct, correct.
Oh, good. 9.
I'm Tina Freeze with Adult Probation. I'm passionate about mental health and substance use. I should say substance misuse. I want to see how it can help our clients, support our clients, coordinate resources to prevent recidivism.
If we think about what we lost, so what doesn't exist right now? If you think about what tomorrow looks like, what could be new, better, or different?
I think the three-pronged approach that Adam has first had, someone to call, someone to come, and somewhere to go.
Yeah. I might write that down. 10.
Hi, I'm Alicia Murray with Daybreak. I'm actually here to listen and learn as well. I don't really have a question at this point in the dialogue.
11.
I don't know if I'm here for this right meeting, but my husband is a client of your South community. We separated 3 years ago. We've been together 19, July to April will be 20, and he has some severe mental illnesses. I tried to meet with the doctor at South Community, which I was blown off. So I filed some grievances due to the fact of the HIPAA violation and several other things. And once I contacted the admin or to Kylie, which runs your grievance department, we were blown off as well. So now my husband is not allowed to go inside of South Community. He has to stand outside to take his medications. I don't know if this is the right meeting to be in, but I talked to Lieberman's office and one of her assistants told me maybe I should come and speak and maybe I can get some outcome and help. My husband's been treated really bad. He started hearing voices and things because they have him on the wrong medications. So when I took upon myself to bring in the right medication list, they still refused to give him the right medication. So I'm living in the bed with someone I do not know, but I'm not leaving my husband's side because of the mental illness. He has an aunt that stabbed her husband 21 times and she's in the summit for right now. So if he was on the right medications that I gave him, then he would come back to himself. But usually when you go that far without the right medications, you don't come back. So I'm begging for help and I'm being kicked out. Now he's not even allowed in the building. So by us filing agreements with their office, and I have video footage of the conversation the nurse had with my neighbor, my whole house has cameras. So when I brought that conversation up, nobody wanted to see the video footage. The admin board has ignored all of our concerns. So as me being a citizen with my husband that is mentally ill, I just want help, and we're not getting that.
Well, thanks for being brave enough to speak out. So I appreciate that. 12. We'll put somebody in contact.
Hi, my name's Ashley. I'm here representing the Dayton Anti-Racist Network. We also work very closely with an organization run by families that have been impacted by police brutality. And so I'm here to both listen and then also hopefully give a little bit of feedback from a group who both receives mental health care and also the leadership is run by mental health care providers.
Thank you. Was that 12? 13. I met you last night.
Thank you. I came a little bit better prepared today. Hi, everybody. I'd like to turn around and speak to the group because this is a rather large room and I personally find it hard to hear
So I'm gonna stand in the middle, if that's okay with everybody. I promise not to take up too much of you guys' time. For everybody that don't know me, my name is Michelle Campbell. And to be honest, I'm just a citizen of the United States and a citizen of the state of Ohio and a citizen of Montgomery County. I've been living here for 41 years and I raised 6 beautiful children who are very successful. I am a woman of God and I believe by faith that God has me here because I have seen so much within the last 11 years when I experienced that my youngest son has schizophrenia and he needed access to care. So I've heard a lot of the same things I heard last night and throughout the different board meetings. So that's why we're here today. We're here today to find resolution for your situation, for everybody's situation in here. So as I was brainstorming last night after I left last night meeting, I came up with some pinpoint ideas as for myself that I believe our community needs and what I would like to see. I'm going to start out with saying that I did some research online of other mental health care facilities throughout the United States. For the state of Ohio and some areas of the 51 states, we rank number about 25. So there's room for improvement. And we have Kentucky, which is down the street, that ranks number 1. So when we're talking about mental illness, for me, it is my adult son. For others, it could be a youth, it could be a mother, a senior citizen, etc. Anybody at any time can experience mental illness. So when we put together a plan, we need to encompass all of that. We don't want to leave any demographic out. So I came up with some ideas, and you guys, you can share yours, but I just have about 15. It won't take, no, 17, it won't take too long. First one that I came up is, everybody know we need a local crisis number. 988 is great, but I still think for the communities that I did research on, a local crisis number is more beneficial than just 988. 988 can be a great backup. Number 2, because we have so many categories of mental illness, and we have terms that are called recurring and severe, et cetera, we need specific treatment for certain what we call severe mental illness. And that one of those is known as schizophrenia, psychotic thoughts, psychotic behavior. And then we have something for anxiety, PTSD, et cetera, okay? And then of course we want to deal with our youth who has suicide, ideation, different things like that. So that's just a few that that's coming to my mind. But if anybody has any, please share it today with us. Number 3, we need to be able to improve the way we transfer or take our patients from the pink slip procedure to treatment procedure. So of course we have 2 categories which you guys already know about, and one is they are danger to themselves, but another one that I haven't heard a lot of is patient who refuse treatment. That's very important because we have a lot of people that do refuse treatment. So if we can group those 2 kind of together as a term that can be used to say if you are refusing treatment, and this has been going on for an extended period of time, and we see and your family members see deterioration, then you have to be pink slip and you need to be housed in a treatment center until we stabilize you. Same thing with danger to themselves, okay? Number 5, of course, counseling. We need to have inpatient counseling in our care center, holistic counseling in our care center, And then we have what we call the spiritual well-being piece. So don't get me wrong, I am a woman of God, but I'm not pushing Christ on anyone. Spirituality is something that we all are part of, and we need to be aware of what's going on mentally, emotionally, and physically in order for us to be a whole person. When we discharge people from the center that maybe they get stable, they go in and they're in there from, say, maybe a day to 10 days, just use that as a window. When we discharge those people, we need to have a plan for them. A lot of people that are mentally ill house themselves at Gateway Men's Shelter and the homeless shelter. Why is that? Because we all know that if we feel the stress of homelessness, not being able to get the proper food that we need, not being able to get the proper care that we need for our health, high blood pressure, maybe diabetes, et cetera, maybe not even having a pair of glasses to be able to read our application and even apply for an apartment, then don't we think that that's even worse for people who suffer with mental illness? So we need to come up with a care plan that includes temporary housing. Now, when I see temporary housing, I see 2 years. I don't know about you guys. And in that time frame, when they leave temporary housing, we want to migrate them to permanent housing. In the same time, I know I'm going a long time. In the same time, we want to make sure that they're getting treatment. Okay, we want to make sure they have outpatient care, they have a patient advocate, this type of stuff that can talk with them, meet with them, making sure that they're staying on their medication, making sure that they're getting what they need. I'm gonna try to hold this question because I'm almost done. So for the residential piece, I see that we need something for 30, 60, 90 days that goes after the 1 to 10 days. Let's see. And I did all that. And then, of course, we did, as I said, we need the mental health advocate. Some of these people don't have anybody to advocate for them. Okay, so just like we got case managers, we got social workers, we need mental health advocates, somebody who they can sign a release to that person and they can help them out, talk to them, help them with their medication, pick up their prescription, making sure that the prescriptions are right, making sure they're going to the appointment, giving them rides, or maybe helping them get bus token, et cetera, et cetera. So that's just a little bit what I had. I do want you to know that we do have a wonderful center in Cincinnati that is not too far away from us called the Lindner Center. And so it would be nice if at some point in time that maybe we can get more information and see how they're doing their thing and try to incorporate that in Montgomery County. Thank you for your time.
Thank you. And then if you want me to take those 17 bullet points, I can make sure those get started up there as well. Because you got through 6, but you had 17.
I know, I was trying to register.
It's fair. And I forgot when, 14. 14. I feel like I'm playing bingo. No 14. And we have some people on Zoom. I'm not sure if I see any. No questions yet. So some of you that spoke earlier said that maybe you might speak later. So when we think around, the purpose of this session is to think about how do we bring to life an RFP that will go to the community. We can talk about building resources.
Yeah, just 2 things. First off, Sean Mitchell and community member. First off, I know looking at a January 1 start, if we're looking at any local resources providers to jump into that, you're gonna have to outfit probably some extra dollars, extra incentives and monies to get people up and going. So just making sure that that's included with that RFP of saying, hey, this is what we can offer you, because if you can't, I don't know how realistic a January 1 is with all local resources. The second thing that really I would comment that I think would be hugely important of moving forward would be, what's the continuous improvement? One thing I heard from a lot of the prior conversations was about different organizations. Specifically, I know our law enforcement wrote a letter stating that, hey, this never worked to our benefit or what we, thought it would. So where are the continuous community conversations, provider conversations to now say, hey, what's next? And is that included in the RFP for whoever that provider is to have to come to the table with other supports, other community influences to do a better job?
Thank you. Would that be in regards to like the mobile crisis? Is that what you're talking about?
Really across the board. So across the board of, it sounds like truly the best option is that three-prong approach initially, and maybe RI, and we know that there were a lot of state issues, a lot of out of our control issues. So what are the things we have in control, and can we find local solutions to help with that?
I think that even the purpose of this event and some of this feedback is, I mean, there are things that were working before really well. Fair. There's some things that maybe might not have worked that well. And what you said is, hey, what can be new, better, different as we evolve off into the future?
What is RFP?
Oh, yeah, great question. So RFP stands for Request for Proposal. So that would be, and maybe what, in my world, what it would be taking the feedback from these events, the three, taking the feedback from the community, taking the competence from the ADMA staff and other community leaders and saying, hey, look, how do we bring this to life in a different way? So specifically the details in regards to what that might look like. Then the entities that would apply for that, right, would have to adhere to the requirements inside of that request for proposal. Make sense? Okay, you.
No.
Okay.
I think for myself, one of the most important things is to create group training for group homes, which Montgomery County has been inundated with group homes. We're representing the entire state. Artists coming here, these are teenagers, and watching our police respond to these homes. They were issues of the staff was not trained to deal with mental health issues in any way. So they were calling on the police to come in and step in. And that was really not their role. So I think it's important for that staff to know these things. And the jail versus mental health, I 100% agree. I think it should be separated. There should be jail and there should be mental health, because that's a whole different program.
Thank you.
I think one of the most important things I've heard a lot today, and heard a lot from the community. One of the most important pieces that I think we should make sure that goes in RFP would be to make sure that no one is left out, as Ms. Rochelle said. We don't want to make sure that, we definitely want to make sure that our kids have a place to be heard or be seen with all the things that's going on in the schools. And not just them, I think it's very most important that whoever does become the vendor per se, that they can take care of everyone that needs help in our communities, as opposed to one just particular, just for adults 18 and over.
Others?
My name is William Davis. I go by Bill. I'm a little underdressed, I guess, for this crowd, but I'm retired. I'm an activist. I have a bachelor's in computer science, and I grew up in a home with mental illness and alcoholism. And I live on a street in Butler Township where 4 of my neighbors were killed by a man with a pistol who has been diagnosed with schizophrenia. And so that's why I'm interested in mental health. If you can see my shirt, I'm interested also in liberty, freedom, and healthcare for all. And earlier today, somebody mentioned something about cost. Yeah, that's the problem. We have to cover the cost of whatever we need. And unfortunately, well, I don't know. Let me step back a moment. Yeah, the shooting on my street was, I don't know, a year after what happened in the Oregon district. DeWine said he would do something. He made it easier to get guns. I don't know. It's all political. Politics, people hate politics. I'm among that group. I'm fed up with the parties, and I've been working for stopping gerrymandering. And if you don't know what that is, you should figure it out. Go to a website called Common Cause or League of Women Voters Ohio. Find out why we need everybody to show up in November to vote on the question that we're presenting to the Secretary of State next Monday in Columbus with petitions with 700,000 signatures. We need to get control. We need more people to vote so that we control our destiny in politics. If you're mad at government, then blame the voters for not showing up and paying attention to elect people who aren't crooks. And that's, I guess I would like to offer afterwards for anybody that wants to keep in touch with me. I'll give you my contact information, but we have speakers across the state and across the country who are working for universal health care. Some people call it single payer. Some people call it Medicare for all or improved Medicare for all. Most people support it. The ones that don't, I don't think are getting the true story about it. And we want to fix that. Thank you.
Others. So part of what we're trying to get up on this wall is in regards to what we had. So what we had was what? A crisis call center. Fair? That's what we had. What we had was crisis mobile, right? A strategy for that. And what we had was a crisis intake center. Fair? Right? And that's okay. But that's not here anymore. Fair? So what we're here to talk about is, hey, if we're going to bring that to life in the future, what would that look like? And so what could be new, better, or different?
I just have a couple. So something that my group is really concerned with is transparency. And so we came up with a couple of ideas to support that. Some sort of public facing monitoring system for calls that are answered and how long it takes for calls to get answered. So rather than no one really knowing this thing, if it is transparent and if there is, we have received this many calls and we're able to help this many people. Also, like an idea of a customer oversight committee so that folks that are being helped can also give feedback. This is what worked for me, this is what didn't. In terms of like an RFP for operational things, we think that the response team should get paid a living wage. And also that folks that are in, that represent marginalized communities should be, given priority for this kind of work, because it's normally those marginalized communities that need help. Just a couple of things.
Thank you very much. Other feedback?
Yeah, I think just again, Sean, to put on record of from past things that I think worked really well, was kind of the call center mobile response being under the same umbrella. I know that was brought up, but one of the big things some speakers came in and talked about from doing that work, that they could work between each other to be able to go and take people where they needed to in the mobile response, but also those calls. And it helped because they didn't have to worry about requests of informations or release of informations and having to go work in between. So I think having one entity that can kind of maintain those pieces might be a good concept or a good idea that seemed to work really well. Another thing is, again, kind of with that oversight, continuous improvement, is maybe be more transparent about the stages of where things are at. We know we're more than likely not going to, out of our control, have a crisis unit where people could stay longer than 23 hours right now. But if that is a future goal, what might that look like? What are the barriers to that? And then can we get involved with that? A lot of it, I believe, might be a legislation issue. Let us do some of that heavy lifting as well as the community members to advocate for those changes.
Other feedback?
Yes, I was talking and I didn't want to take too long, but I forgot to mention back in the 90s, I think it was late 80s, early 90s, we had a problem with our welfare system. So we had Montgomery County had a board, community board for the welfare department. I was fortunate enough to be a part of that and appointed to sit on that board. And we had the challenge of trying to make welfare better, providing jobs and care and keeping people on benefits or partial benefits while they transitioning from welfare to workfare. So there was a state, Wisconsin, that had a program that was phenomenal. Forgive me, I got a minute in my mouth. And they sent us there to, some of us went there to meet with those people and learn about what they were doing with their one-stop shop center, where they were offering jobs, daycare, food stamps, et cetera, et cetera. And we decided as a community to have the one-stop center that now is in place on Edward C. Moses Boulevard. We no longer, for years, have a separate building for different things. Okay, if you need childcare, you go there. If you need child support, you go there. If you need a job, you go there. If you need training, you go there, et cetera, et cetera. The question is, in our community, are you guys open to creating a one-stop center for mental illness? And what would that look like? Could it be something that we could do, just like we did with our job center, but maybe to, tweak it for mental illness and then use that piece to collaborate with Eastway, Noble House, CAM program, Care Mental Health, et cetera, et cetera. Could they all have an office in that building? Or could they use part of that building for some of their services? I'm just thinking just thinking. Let's really think about this. and come up with some really great strategies, because our children lives, those who are coming behind the adults, those that are in school now, they're gonna need this. So I just wanted to say that. Thank you.
Scott, 5 minutes. 5 minutes.
Is that called right?
Yes. No. Yep. It's 5 till 2.
Is it really? Oh, I'm looking up, okay.
Yeah. Got it. I was looking at the wrong hand, so. Any last comments?
So again, the group that I'm representing, Dayton Anti-Racist Network, and we work with very closely Ohio Families United Against Police Brutality. And I guess I would be curious to hear from other folks that have been impacted personally by this. The role of police in any of these mental health crises. So our group believes that having law enforcement be a part of any protocol is not a good idea and mostly only causes more harm. So I guess I would also be curious to hear from other folks that this has impacted where you're at on that.
I was gonna say, okay, we got about 4 minutes, so that's a big question.
I have to disagree with you. I think that there are situations where that's probably true. But I can also say that having dealt with this personally and been there when it happened, the law enforcement was very professional. They added that piece that they had the training of how to create intervention here, how to talk to this person, how to get them to respond. And I know that other police officers spend a great deal of time. They need more training. We did add a mental health officer, and he came into our community, and the very first thing he said after a week of riding with our officers was, "I had no idea that you deal with this every single day and how professional you are." So I think it's being a little bit judgmental here.
Well, I don't think, maybe I'll stick up myself. So I come from the insurance industry, right? I think, and I said last night that, I think sometimes good ideas die inside of insurance companies. And I do believe that whether it be police or other people, that for the most part, even like my industry, the intent, the compassion for humanity and others exists everywhere. There certainly are situations, and that's evident in my industry and every other industry. But I think the people that do that work every single day. I was a really big fan of, like, you think of that mobile crisis unit, that mobile unit, in a beautiful way, is if it was just professionals that, there weren't lights on and people could pull inside of a driveway, right? That would be amazing, be incredible. The problem is we don't have the money to fund them. We don't. Like, it just doesn't, that does not exist. And then we're asking law enforcement. I'm not sure they have any idea what's in front of them when they go to a home. They don't know. We're asking them to be a lot, right? And to sort of have that resource next to them, I think is valuable. It's a real asset to our community. So I appreciate everybody being here. There's no question about it. It's a big subject. It's a big topic. And unfortunately, I said last night, the state of Ohio spent $1.8 billion in mental health and substance abuse disorder in this state. It's a lot of money. There's more effective ways to spend it. There just is. And one of the bigger things too is when you look at this, it looks like a spider web. If you have a family member, if you have a son or a daughter or somebody that's hurting in mental health, whether it be substance abuse disorder or mental health, And it looks like a spider web, and it should not look like a spider web. It should be easier to navigate. It should be easier to move through the system. The outcome should be better and higher. So thanks for treating me with kindness and respect and dignity. I appreciate that. Thanks for your feedback, and have a great day.
Yeah.